The Family Health Podcast is brought to you in partnership with Things Happen, a trusted financial advisor that supports new parents and their families. Things Happen offer the best advice to help parents and their families make informed financial decisions, ensuring a secure and tax-efficient future for their children. The team at Things Happen are highly qualified financial experts who will guide you through the different types of policies to consider as your family expands, taking the stress out of decision making by finding the best deals for your needs, ensuring you and your family are protected no matter how busy life gets. If you already have life insurance, Things Happen will carefully review your existing policy to ensure that it still meets your family's evolving needs, so you know your family is fully protected.
Hello everybody, my name's Kate Ball. I'm the founder of Mini First Aid. Welcome to our podcast, Family Health by Mini First Aid. I'm always delighted that you've taken the time to listen to our podcast, because whether you're in the car, you're cleaning the house, relaxing with that well-earned cuppa, out for a walk or a run, our Family Health podcast covers a huge range of topics that might affect one of your family members. And if you've ever got a family health concern and you're thinking, I'm just going to Google it, have a listen to us instead. Now, today is a very special subject in the sense that this is a listener request subject. In fact, loads of you have been in contact with us to say, please, can we talk about children's eye health? And so therefore, I'm feeling very lucky that we've managed to secure the lovely Dr Nigel Best with us today. Nigel works for Specsavers, heading up the professional services team, and he is absolutely expertly placed to discuss all things children's eye health with us. So welcome, Nigel. Thank you for joining us.
Hi, Kate. I'm very flattered. Thank you very much. It's lovely to receive an invitation to be on your show today.
Nigel, before we get going and we start talking and delving into the world of children's eye health, tell us a little bit about yourself and what you do.
Okay, so, I'm an optometrist, which is, I guess, a slightly posh way of saying optician. And I've been an optometrist for about 30 years, and I've worked for Specsavers for my whole career. For about 20 of those years, I was what you would call, I guess, a community high street optometrist. I took a bit of time out to do my doctorate at Aston University, and then I went back into the consulting room about 7 years ago. But more recently, as you say, I head up Specsavers professional services team. So we employ about 5,000 opticians across our stores. So I just provide support to the guys that work in our businesses, looking after all of your listeners.
Amazing. Now, we want to delve into the world of children's eye health. And even as a mum of 6, I can't always remember the care pathways or the health pathways that all of my children have had. And I'm just keen to know about children's eye tests. Are eye tests part of standard development checks, or is this something that a parent has responsibility for?
Yeah, so I have 2 boys, and when my children, at the time I was living in the northeast of England, and there were no visual checks done as part of their standard development checks. So my understanding is that it's a bit of a postcode lottery, but my own experience was nothing was done. So I think on that basis, given it is potentially a postcode lottery, I think that the onus probably sits with the parents to know that those checks have been done, or if they haven't been done, to try and arrange for those checks to be done themselves.
So thinking then about having your children's eye checks done, which just blows my mind that it's not a standard development check, because you'd think that would be a huge part of children's development, their ability to see. But let's just talk then about going to the optician. So when should children start to go, or do you wait until you suspect potentially an issue with your children?
It's a really good question. If you don't suspect that your child is having any visual problems at all, then I would say ideally you're looking between the ages of about 3 and 4. Okay. However, if a parent has any concerns about their child's vision, then you certainly wouldn't wait. If you have a child and you've any concerns that they may have any visual problem, then I would suggest that you would take your child to see your optometrist, irrespective of their age, really. And if they are too young for the optometrist to feel that they can competently carry out an examination, then they can refer them to somebody who, or signpost you to somebody who can do that. So I think it really depends on what concerns, if any, the parent might have, Kate.
Okay. And is it, you say it's perhaps it's earlier than you would expect. What's the average age then that people bring their children? Obviously, you've talked about your recommendation, but what's the average age, perhaps at Specsavers or across the world of optometry, that generally you see children for their first eye check?
I guess I can only really talk from my own experience. I'm not sort of referring to any data here, but I would say quite often parents don't bring children unless they have a concern,
Right,
which would often be something like the child is struggling to read in school, or maybe their handwriting is poor compared to their peers, or sometimes a parent might think that the child is developing a bit of a turn in their eye. Those children would often present in and around the ages of maybe 6 or 7. The next cohort you tend to see is the children who are beginning to go short-sighted. So these are the children who are struggling to see the whiteboard at school, and they would often be brought in maybe about the age of 11 or 12. So for me, I think the issue we have is that a lot of parents do wait until they either perceive a problem or the child tells them that there's a problem. Rather than being a little bit more proactive.
Yeah. So like a dentist, right? So we all go and have dental checks, or we should do with our children. We don't wait for our children to have toothache, but perhaps there's not that same momentum as with children with eye health, maybe.
Yeah, I would agree with that. I mean, I think most parents present because they have a concern.
Yeah.
Where really, I think as an optometrist, we would like to be seeing those children before they start school. So maybe about the age of 4, because it is very possible that your child will have a visual problem, but won't be demonstrating necessarily any problems themselves. You won't, as a parent, you might not pick up on that. And the child has no point of reference. I mean, they don't know how their vision should be.
No, of course.
So that child might assume that their vision is absolutely fine.
Mm-hmm.
And it's only when you have their eyes tested, ideally before they start school. And it's a really good age, Kate, because some of the problems that we see in children, for example, lazy eyes, if we see the kids around 3 or 4, these things are really easy to treat.
Right, okay.
Not, well, easy is the wrong word, but they're treatable.
Yeah.
Whereas I remember a long time ago, Specsavers ran a really nice campaign called 8 is Too Late. And we were sort of saying to parents, by the time they get to the age of 8, if we pick up the eye problems at that point, it's much, much more difficult to correct them. So my advice would be to parents, whether you suspect your child is having a visual problem or not, if you can bring them in for a test in and around 3 to 4 before they start primary school, that would be perfect.
And from a cost perspective, would you as a parent have to or be expected to pay for a children's eye examination?
No, I mean, in the UK, under 16s are all entitled to an NHS-funded eye examination. And if the child remains in school until they're 18 for whatever, then it actually extends to 18. But no, you wouldn't need to pay for the examination. Following the examination, you will be provided, if the child requires glasses, you will be provided with what we call a voucher, which will go towards the cost of those glasses, and very often will fully cover the cost of those glasses. So it's entirely feasible for a parent to take their child in, have their eyes examined, and also be provided with any glasses they need. And I mean, really lovely glasses, and there would be no charge at all for the parent.
I was actually gobsmacked. I've got several glasses wearers amongst my children. I've got 6 children, and several of them wear glasses. And I was pleasantly surprised when we came to choosing glasses, just what an incredible selection of glasses there is versus what I remember from my childhood, and there being a boy frame and a girl frame, which now is not even a thing, is that there's just this huge range, and also that wearing glasses is now really cool, whereas when I was a kid there was a sort of a stigmatism about wearing glasses, and I just don't think it's there for kids these days.
No, I don't. I agree with you. And I also remember the boy and the girl frames, the little pink pair and the little blue pair. I remember those. And I mean, the range of children's frames now, they're beautiful. And quite often in store, what we'll see is, particularly with the smaller ladies with the quite petite faces, they'll actually end up getting one of the unisex children's frames because they're so stylish. Rather than going for a small adults, will see adults with a petite face going for a child's frame because it fits them perfectly and they're lovely styles. So it's not something that I would see often, whereby you have a child who's a reluctant spectacle wearer. In fact, I remember when I was practicing this is going back a while, this is maybe going back 10 years or longer, but after the Harry Potter movie, the children were mad for glasses.
Everyone wants glasses. Yeah,
Everybody
right.
wanted
Yeah.
them. And the problem we had as clinicians was that the children would come in and they would try and convince us, and they would try their damnedest to convince us that they couldn't see anything. And I'm looking at this child
Couldn't read the
thinking,
letters.
I think you can read those letters. I wouldn't say that, but I was thinking, I'm pretty sure. So we all had to develop little tricks to trick the children into reading these letters, because we kind of knew they could see,
Brilliant.
but the child would be trying to convince us that
They want
could.
a pair of
They
frames.
wanted
We
some.
had that very experience in our house. I've got twins where one twin wears glasses and one doesn't, and the one that doesn't very badly wanted a matching pair of glasses to look cool.
Yeah, I bet.
Nigel, just talking about children's eye health, and in particular some of the more common eye issues, I think perhaps we assume that everybody knows what the terminology means, and I think it would be quite helpful for our listeners for us not to assume that. So can you tell me what sort of short and long-sightedness actually means when somebody is referring to those in terminology?
Yeah, sure. So if you don't mind, I think I'll start with long sight first, because it tends to happen first. So most young children, if we look at children who are 3 or 4 years of age, they have a small amount of long sight, but it generally doesn't need to be corrected. It doesn't cause any problems. So if you go to the opticians, very good chance to say, well, your child is a bit long-sighted, it's fine. And then over the next 3 or 4 years, that would sort of generally ebb away. When we get more concerned is when there is a significant or quite a high level of long sight. Now that is something that essentially makes it difficult for your child to see things up close. So if your child is significantly long-sighted, they might struggle with tasks like reading, writing, their handwriting might be poor, maybe even putting blocks in the right shape of holes and things. Those are the sorts of things you might notice your child struggling with if they have a high degree of long sight. And that's present in about 1 in 15 children. So it's not a rare condition, but your child probably won't complain. So those are actually the ones we want to pick up early. If we can get those when they're 3 or 4, those are the ones we really want to be on top of in the young children, because they could really affect that child when they're moving into those early school years. They're also the ones actually that predispose the child to getting a turn in the eye or developing a lazy eye. So we really want to, this is why we want to see the kids before they start school. It's really to pick up the kids who have a lot of long sight. If your child doesn't have a lot of long sight, or has relatively normal vision as a 4 or 5-year-old, the next really milestone, the next time you're really thinking about is, well, are they going to become short-sighted? And that tends to happen a little bit down the line. So maybe they're 9 or 10. That's when, with short sight, they get blurred vision for distance. So this is when they're maybe they're moved to the front of the class, and they're struggling to see the whiteboard. Maybe they can't, they'll tell you when they're sitting and they're playing on their PlayStation or their Xbox and the TV, things aren't clear. So those, I guess, would be the two main things we're looking out for, and almost at different stages in that child's journey.
And are they generally, for long-sightedness and short-sighted, are they generally corrected by the wearing of glasses?
Yeah, particularly for the younger children. So when you have, I would say up to about the age of 10, glasses is really your only correction modality. Once the children get a little bit older, probably 11, 12 and upwards, contact lenses do become an option. Now, so I think contact lenses are probably an option earlier than parents think. Now, some optometrists, when I was practicing, I was always quite comfortable fitting children with contact lenses, particularly the children who were maybe suffering from any sorts of bullying, or who were, for those children, I would, if the parent comes into me and says, my son's getting bullied because they're wearing glasses, I would have said, okay, this is the option. Or again, the children that are doing sports and they're finding that if the child's a really keen rugby player and the glasses just don't work, then I was always quite a fan of contact lenses for children. But so contact lenses do become an option when the child is older. And I think something that's a very interesting development in the last couple of years is that As a profession, we're noticing lots more cases of short sight. It's doubled in the last 50 years, and we now have what we call myopia. Sorry, myopia is the correct name for short sight. We now have what we call myopia management lenses. So you can now get glasses and contact lenses, which can really slow down the progression of short sight, which is really important for lots of reasons. But going back to the original question, for the younger children, glasses are probably the only option. But then there are other options as they get older.
So what I found fascinating with one of my children is that they had a long sight and a pair of glasses on prescription, which they only had to wear for a couple of years, and then it improved, which was incredible. I just assumed from my childhood that once you had glasses, that was it. You were wearing glasses for the rest of your life, and that seems to be different.
Yeah, I think, Kate, it depends on the degree of long sight. In children with, let's say, relatively small or moderate amount of long sight, they will quite often wear glasses for a period of time, and then they get to the point where they don't need them as much. So you might get a child who's 5 or 6 and they're wearing glasses, but then you see, you have to remember, Kate, that there is a critical period in our children's vision's development. So up to about the age of about 8, our children's vision is still developing.
Okay.
So you would have a child, let's say you have a child where there's a bit of an imbalance between the eyes, and well, listen, let's say, for example, the child is 6. You think, right, well, I've got 2 years in this child where I can try and correct the imbalance. So for those 2 years, I want the child to wear these glasses. They wear them full time. We get the eyes as well balanced as we can by the age of 8. Now, once they get to 8, the visual system is then, the vision's pretty locked in. So at that point, you might say, well, actually, okay, we're locked in now. Hopefully we're at a good standard. Your child's not having particularly any problems without the glasses. I think we can now have a period of time without the glasses. So you can then move away from spectacles for a while. But in those children, you will often end up moving back into them sometimes whenever they get a bit older, and maybe they're studying for GCSEs and they're doing lots of close work or lots of screen work. So these children, they don't always get a reprieve forever. They quite often end up having a reprieve for a while, and then they end up getting back into them.
Sure.
But that what you're describing is not unusual. But what I would say is with the children with the very strong prescriptions, if you get the 4-year-old who's very long-sighted, they're kind of in them for life.
Yeah.
Those ones don't get that reprieve. It's only the ones with the lower prescription sometimes will get a period when they don't need to wear them.
Talk to me about what a squint is then. If I was referring to a squint, what am I meaning?
Well, when a lay person talks about a squint, they're usually talking about an eye which is not straight. Okay, so I for many years, my job was training sort of newly qualified optometrists. And I always said to guys, I said, if a mum or a dad comes in and says that they think they've seen a squint in their child's eye, I said, you better believe them, because I can guarantee you in the vast majority of cases, they will be right. Because squints can come and go, Kate. So a parent will come in and they'll say, I was looking at my child last night, and I just feel like when I was looking at them, one of their eyes drifted in towards their nose, but it looks fine now. That's actually quite a common description. These squints in the early stages can be what we would call intermittent. They're not there all the time, and they're nearly always going in. It's very unusual for an eye to turn out. Usually one eye will remain straight and the other eye will turn in towards the nose, and it might only do it for a few seconds, and then it'll right itself again. And it'll tend to happen when the child is tired. The child's been doing maybe a prolonged visual task like homework or gaming or whatever they're doing. But these squints are usually a sign that the child has got quite a significant amount of long sight. That's what's nearly always causing it. So I was saying these sort of 1 in 15 children are quite long-sighted. These are the ones that you want to pick up when they're 3 or 4 years of age, because the squint occurs when the child's eye muscles are working so hard to overcome all of this long sight that one of the eyes will start to turn in towards the nose, and eventually it'll turn in and it'll stay in.
Right, okay.
The good news is that when they start wearing their glasses, ideally they put their glasses on and the squint is completely corrected. They wear their glasses and they're completely straight. But sometimes when they put the glasses on, it'll only partially correct that squint. They might end up down the line needing some further treatment for that. But squints are generally a sign of long sight. And you tend to see them once the children start doing more demanding visual tasks about that age that they're approaching school age.
Okay.
But I think and any parent who thinks that they might, even if they've a smallest suspicion that there might be a squint there, they really need to go and speak to their optician about it.
Okay. Is that different or the same as lazy eye?
Okay, so there are two. Well, first of all, a lazy eye is an eye in which the vision has not developed. So if we think whenever we're babies and when we're very young, babies have very, very poor vision, and vision develops up to about the age of 8. But a lazy eye is an eye in which the connection between the eye and the visual cortex, which is right at the back of your head, that's the part of the brain that we see with, the connections aren't made. So you don't have the eye is perfect. There's nothing wrong with the eye, but the neural connections to the brain have never really developed. So that's what a lazy eye is. And lazy eyes are present in about 2% of the population. So they're relatively common. There are two main causes of a lazy eye. The first main cause is a squint. So a squint would be a very common cause of a lazy eye. The second main cause of a lazy eye would be when the child has got quite different prescriptions between the two eyes. So let's say the child has got perfect vision in their right eye and pretty poor vision in their left eye. But as far as the child can see, they're very happy with their vision because the right eye is so good. They can do everything they want to do, but the other eye is actually quite poor, and the child never complains about it because they don't notice it. They're not aware of it. And then the child, this is the problem, that then the child gets to 8 or 9 years of age, they go for their first eye test, and you say, well, yeah, the right eye is perfect, but the left eye is quite lazy, and it's because they have quite a strong prescription in that left eye, which has never been corrected. And once you get past about the age of 8, it's very difficult to correct a lazy eye. It's almost impossible, actually, to correct a lazy eye after the age of about 8.
Okay, that's fascinating. One of the things that sits in my prescription is something called astigmatism. And it wasn't until, actually, I confess, not that long ago, that I actually understood what my optician was referring to. So tell our listeners, what is astigmatism?
Yeah, astigmatism is really misunderstood. So first of all, it's not a disease.
Yeah.
Because sometimes people think that they think they've actually got a disease. It's not a disease. It's very, very common. Astigmatism is probably more common than short sight or long sight. So it's a very common refractive error in the eyes. And essentially, in an ideal world, at the very front of your eye, you've got a structure called the cornea. Now, you can't really see it because it's completely transparent, but it's like a dome that sits on the front of the eye, and when you look, you can see behind it is the colored part of your eye, which is your iris. So you've got the cornea, which is the very front of the eye, and ideally that cornea would be perfectly spherical, like a football. Okay, but in lots and lots and lots of people, that cornea is not a perfect sphere. It's slightly more shaped like a rugby ball, which means that it has essentially has two different powers in two, what we would call two meridians. So your cornea might have a power of 5 up and down and 4.5 along the horizontal, and that results in what we call astigmatism, and it is super common, and you usually find it coinciding with a bit of short sight or a bit of long sight. So when you have your glasses, let's say for an example, you might have 3 units of short sight and you might have half a unit of astigmatism. And that would be very, very common. In fact, most people who wear glasses will have a very small astigmatic correction in their glasses. Now, if it's so small, the optician might not even mention it. You might say, well, listen, you're short-sighted, you need glasses for driving, etc. They might not even mention it. But when it becomes more significant, of course, you would say to the patient, but actually there's also quite a significant astigmatic component to your prescription, which we also need to correct. So not a disease, super common, and can be corrected with glasses or contact lenses, or when you're older, refractive surgery, whatever you want, really.
So we've talked about some of the more typical children's eye issues. So I think just so far, people listening must go from the numbers you've given us and when corrections are better made and all those sorts of things, that we're probably all nodding going, right, we need our kids in earlier for eye appointments. So when you go for an eye test with a child, what happens? Because we've all probably been as adults, and I hope everybody listening has had an eye test as an adult, but for a child, how does an eye test differ in their experience? How on earth do you test somebody that can't read properly yet? All of those sorts of things. What's different for a children's eye appointment?
Okay, so During any eye examination, an optometrist will, broadly speaking, do two different types of tests. They do what are called objective tests. Now, an objective test is a test that requires no subjective response from the patient. And then they do what are called subjective tests, which most of your listeners will be familiar with, where the optometrist might say, I know you all hate these questions, is it better with one or two? Are the circles clear on the red or on the green? Those are subjective tests because we're asking the patient to make a choice. With a young child, you can't rely on the subjective information you're getting. Of course you can't. You can't ask a child to make those decisions. So with the young child, you rely much more heavily on objective testing. And that objective testing can be made, it usually means asking the child to look into a particular machine or shining lights into the child's eyes. But the important thing is you don't really need much in the way of cooperation. All you need is a child who hopefully can sit still and look at what you want them to look at. And the good thing is whenever you start shining a light into a child's eyes, they're actually pretty good at looking at the light because it takes their attention. But as well, what optometrists will often do the first time they see a young child, they'll put drops in the child's eyes. Now, this is a special type of eye examination called a cycloplegic eye examination. It makes the child's pupils very, very large. So it does blur their vision for a day or so. So it's not the most pleasant thing for a child. But when you put those drops in, it allows for a very accurate, objective assessment of the child's vision. So vision is maybe the wrong word, of the child's prescription. So once you've put the drops in and you've done that objective test, you have a pretty good idea, is the child short-sighted, is the child long-sighted, does the child have astigmatism? So that's a really good starting point. Once you've done that, hopefully you can check the child's vision. Now, again, there's maybe a misconception that children need to be able to read or even need to be able to recognize letters. Again, that's not the case. I mean, what I would have done with the very young children when I was testing, first of all, I would have asked mum or dad to sit in the consulting chair and I would have put the child on their lap.
Okay.
So the child is sitting on mummy or daddy's knee. So they're feeling more comfortable in what could be quite an unusual environment for them. You know, if I needed one of the child's eyes covering, I would actually ask the parent if they wouldn't mind just using their hand and covering the child's eyes. And then I would give the child a little card. And that card would have pictures on it like a tree or a boat or a house or a car. And I would stand at the other end of the room and I would show a child a picture. I would hold up a card and there would be a car on it. And I would say to the child, can you just show your mummy or daddy where that car is? And then they would point to the car. And then I would show successively smaller images. And these images are specially designed to allow you to give quite an accurate measurement of the child's vision. So they're not just a random car scribbled on a piece of paper. The way the cars or the trees are drawn is actually quite scientific, so that at the end of that, you can actually quantify the child's vision. You can say, well, have they got 6/6 vision? Have they got 6/12 vision? So that's a way that you can assess vision in a young child without them. They don't even need to talk to you. If they're very nervous and they don't want to say a word, they can just glance up at their parent and point to the car. That's all you need them to do.
Great.
You know, there are other tests. We can put on special glasses for the child, and then we can check what's called their stereopsis, which is their depth perception. So we would show them what looks like a pizza with a slice missing, and they would look through these red and green glasses, and we can say, well, can you show me where the pizza slice is missing? And they just have to point at the pizza. There's no slice there. Or so there are lots of things optometrists can do to check the vision of children who are very young, who probably aren't particularly cooperative, who don't necessarily even recognize letters, let alone are they able to read. We can still get a pretty accurate assessment of those children. But it's amazing at what point you can move to quite an adult type examination.
Yeah.
See with some kids, they're like super switched on. And you sit down with them and they're only maybe 6 years of age or something, and you do quite a grown up, because ideally you want to do a test which is a combination of those objective and the subjective tests. And there are some children who from quite a young age can do quite a grown up examination, and that's brilliant. But there are other children, of course. Every child is individual. So I guess it depends very much on the child, but certainly by the time the children are getting to maybe 7 or 8 years of age, a lot of them are able to do an examination that the parent would recognise as being quite similar to the one that they had.
Yeah, brilliant. And once they've started that journey of going for eye appointments, how often would you like to see a child in a practice, in an an optician's? How often would you want them to be coming for appointments?
It varies. If you had a child in and you did an examination for the first time, let's say you had a 5-year-old child in and you found that they had a significant amount of long sight, maybe they had a bit of a lazy eye, I'd probably want to see that child again quite soon. I might see them in 3 months. I might then see them in 6 months. So they would be seen quite frequently. However, if you had a child in who, again, a 5-year-old child who has got normal vision and no significant long sight, you're very happy to see them in a couple of years' time.
Great.
With the caveat that if the parents have any concerns at all, of course, that they bring the child back to see you. So a lot of children, by the time they get over the age of 8 and you're outside that critical period, for a lot of them, you're seeing them every 2 years, just for routine checks. Now, I suppose one exception would be the children who are short-sighted. So once you get into the 12 and 13-year-olds who are wearing glasses to look at the whiteboard in school, we would expect their vision to deteriorate by about half a step a year. So if they're a -1 when they're 12, when they're 13, they'll be a 1.5. When they're 14, they'll be a 2. When they're 15, they'll be a 2.5. Those half a unit steps are sort of quite significant. So for the children who are short-sighted, it'll probably be annual. But again, for the children, for the 12, 13-year-olds who don't really need anything, it'll probably be every 2 years.
That's fascinating. Now, I was going to ask you about perhaps some of the things that happen to our children's eyes as to whether really we should be seeing the optician or whether we should be going to the GP. And one of the things that sprang to mind was conjunctivitis, or sometimes known as pink eye, or styes, things like that. Are they a vision thing, or should we be going to the GP or the pharmacist? What should we be doing with things like that?
Okay, well, if you'd asked me this question 10 years ago, you would have had a very different answer.
Okay.
Because in the past, these conditions were quite often managed by the general practitioner.
Okay.
There has been a massive shift in that, in as much as obviously as optometrists we have more training in eyes. We have equipment that the GPs don't have access to, and I'm not denigrating the GPs, but we have microscopes and things which are just for looking at the eyes. And most in all of Scotland, all of Wales, all of Northern Ireland, and in most of England, there are now services set up whereby if your child has what we would call these minor eye conditions, if your child has a minor eye condition, your first port of call now should be your local optometrist, the opticians. That will be your first port of call. And in most of these areas now, with the exception of a very small number of areas in England, you will not have to pay for that because there is what we call a locally commissioned scheme.
Right.
So your child they won't have a sight test because they don't need a sight test. They need more of an eye health check. So they'll go in with a pink eye. They'll see the optometrist for more of an eye health check. There will be no charge required. There'll be no charge for the parents to pay. They'll be seen free of charge. And at the end of that, the optometrist will give the appropriate advice and advise the parent how to manage that condition. And so that's a big change. And a lot of GPs now, if you ring them up and say, well, my child has a sore red eye, they're not going to want it. They don't want to see you. I mean, they just don't. They're going to say to you, well, okay, we have a scheme and I need you to go to Specsavers, or I need you to go to Boots or Vision Express or whoever's providing the service, but they will refer you to the local provider, and that will always be your first port of call.
Brilliant.
And what's even better is what we're seeing a lot of, Kate, in the last decade. A lot of optometrists are now getting what we call an independent prescribing qualification. So the optometrists are now have access to and are legally allowed to prescribe a lot of treatments for conditions which in the past they wouldn't have been allowed to do. So the whole eye care is very much shifting from the GP into high street optometry. And interestingly, we also see a lot of patients who in the past would have been seen in the hospital eye service are now coming back into community optometry. They're not children, but it's just a shift that a lot of the eye health stuff is now sitting in the high street, which is way better for patients.
So that leads me on then to this question of other issues around the eye. So perhaps more eye injuries. So this is children and everybody in our family, really, isn't it? That if there is an injury where something has been rubbed in or got into the child's eye, and you're concerned about your child's eye health, are you now to go to your optician instead of perhaps you would have gone to the GP saying my child's got something in the eye?
Okay. Well, first of all, it's definitely not your GP.
Yeah, okay.
I think for me, the question is it your high street optician, or is it somewhere more like an eye casualty or A&E? And that, I think that's a bit of a judgment call for the parents. Now, my advice would be, if your child has gets something in their eye, or as you say, anybody, and they're complaining of a bit of a discomfort, the eye might be a bit red, they're maybe grumbling about it. We've all walked down the street and had a bit of something blown into our eye.
Yeah.
That sort of scenario is definitely one for your high street optician, because they can look on their microscope, they can establish if there's a foreign body, where it is, what it is, and there's a very good chance they can remove it either by irrigation or another technique. So in those cases, definitely your optician. My only reservation would be if the individual was in a lot of pain. If we have somebody who is in a let's call it a very painful eye, and we suspect that something might have embedded itself in its eye. Let's take an example. Your husband or your partner are out in the tool shed and they're hammering away at a piece of metal, and they come in and they're in a lot of pain and the eye's very red. In those scenarios, I think it would be more sensible to seek medical advice by going to ideally an eye casualty if you have one, or an A&E, because they might need some more invasive treatment than would be provided. Now, interestingly, there are now some optometrists who will provide that higher level of foreign body removal, where they're putting in anesthetics and they're using special devices to remove foreign bodies, but they're unusual. So I think if you're in a lot of pain, you're probably better in eye casualty. But if you're in a lower, just a relatively small amount of pain, and I think your optometrist would probably be able to deal with most of these things.
Brilliant. I think it's fascinating how the change in sort of direction as to where we're going for service provision is brilliant. I've got a question which actually I hadn't warned you so much that it was coming, but I want to ask you because I'm sure you'll have an opinion, which is around screen time and the prevalence of children with eye conditions, etc. And just wanting to know your thoughts or perhaps even your advice, because as parents, we feel sometimes that we're being beaten up from all angles as to how we parent and what we do. But is there an increase in conditions in children as a result of screens? And is there something that we could, as parents, be doing about that?
That's such a good question, Kate. And honestly,
I'm so sorry. I'm just a mum, and I needed to know.
I know. And do you know what? If I had £1 for every time a parent would come into my room and say to me, "My child's eyes are getting worse. I can't get them off their screens. Please, please, please help me. Just say something.
Please tell them.
Tell them to stop." No, okay. So it is joking aside, it's a very interesting question, because as I mentioned to you before, we are seeing a big increase in short sight. Okay, in the last 50 years, short sight has doubled, and there are parts of the world where it is an absolute epidemic of short sight. And there has been so much research in the last couple of decades into what is driving this surge in short sight. And I'm really sorry, Kate, but the evidence for screen time playing a very strong causative role is actually quite weak. So could I say to you, your child's short sight is happening because they're spending too much time on their iPad or Instagram? Or I probably can't say that. However, I love this. Quite often people say, well, an absence of evidence is not evidence of absence. I love that saying. But what I can tell you is, what I can say with certainty is, indoor lifestyles are believed to be one of the most significant contributors to short sight. There is something, and again, the mechanism is poorly understood, but the evidence is very, very strong that children who spend more time outdoors are either much less likely to develop short sight, or their short sight progresses less slowly. And of course, we can all see a link between screen time and outdoor time, because our kids are indoors and screens. I mean, my two boys are the worst culprits in the world. So I say to parents, I can't tell you that your child's screen time is causing or driving their short sight, because we simply don't have the evidence for that. But I can tell you that if they were off their screens and being outside a bit more, that would slow down the progression. And that's pretty much as good as that's as strong as I can make it on the current evidence.
I'll take that, because that's what I shall be saying to my children this evening when they're all face down and don't even acknowledge me when I walk in the room. But it's been fascinating chatting to you. And, and I think I'm excited about the eyewear for kids. I think it's brilliant. I was going to talk to you about reluctance in wearing glasses. Do you see that much now, or do you see that children are generally quite willing to wear their glasses once prescribed?
I don't see a lot of reluctance. I mean, maybe in the past a little bit when the frame ranges were much more limited, but glasses, children's glasses, they've such lovely styles now, and we can thin their lenses down, and we can do them prescription sunglasses, which look really cool. And so, no, I don't see an awful lot of reluctance. Do you know what, Kate? It's the parents who are reluctant. It's not the kids. It's the parents who are saying, "Oh my God, I don't want my child to wear glasses." The child's sitting there saying, "Hey, Mum, I'm cool. I can wear specs.
I'm there.
I'm with it." And it's the parents who are reluctant. It's the parents who are upset. I mean, of course, you'll get every now and then it's quite often boys who'll go into school and they'll wear their glasses on the way to school in the bus, and then they'll go into school and they'll maybe stick them in their pocket when they're in school because they're not that cool. And then you'll see them next time and you'll say, "Are you wearing your glasses as much as you should be?" And they're like, And in those cases, if you do get, and it is quite often boys for some reason, if you do get the boys who are a bit reluctant to wear them in school, then that's when there's a conversation around contact lenses. But no, and you don't see an enormous amount of reluctance, really.
No, I think the whole conversation that we've had today has been absolutely fascinating, and I hope all of the listeners have thoroughly enjoyed listening to our conversation and all the fantastic information that you've shared with us on eye health. From your perspective and from the team at Specsavers, is there anything as a takeaway? We always ask every guest this at the end of a podcast. If people could take away one thing from our conversation today, is there one thing that you would like people to take away in the realm of children's eye health?
Yeah, the one message has got to be: take them for an eye examination before they start school, and don't assume that because they're not complaining of any visual problems that everything's fine, because it might not be. I mean, if parents were to do that, that would just be a game changer.
Brilliant. Nigel, thank you so much. You've been listening to the Family Health Podcast and our guest, Nigel Best from Specsavers Opticians. Nigel, thank you. Folks, as usual, if you would like to send in any requests for any further family health subjects, we would be delighted to hear from you. Make sure you subscribe on our podcast channels, whether you listen on Apple or whether you listen on Spotify or on the Family Health website, whichever way you choose to listen. Make sure you subscribe, and the new episode each week will drop into your mailbox. And if you want to see what we look like, you can also watch the footage of today's podcast on our Family Health Podcast YouTube channel. You have been listening to the Family Health Podcast.
And just a little reminder from me and our sponsor, Things Happen, that if reviewing your life insurance is still on your to-do list, take time to get in touch with a Things Happen advisor today.